Sciatica is not a condition, but it is a symptom of an underlying disease. It is defined as a compression of the sciatic nerve, or one of its roots or branches, resulting in pain, which shoots down to the leg, usually affecting one side. It is a huge no in the body arising from the lumbosacral plexus with the root values L4, L5, S1, S2 and S3. It runs down the lower back, continues in the posterior thigh and at the level of popliteal fossa. That is the posterior aspect of knee. It divides into two terminal branches. The tibial nerve, which supplies the posterior compartment of the leg, and peroneal nerve, which supplies the anterior and lateral compartment of leg. Sciatica happens due to back pain or lower back area, but it can be experienced along the spine. The lower back is the connection between the upper and lower body. It bears most of the body's weight. Pain in the lower back area can be caused by an irritation or problem with the tendons and muscles, nerves, and nerve roots, joints and spinal discs found in the lower back area. Lower back pain can be dull or sharp and may be felt from a localized spot or over a broad area. When the pain felt in the lower back area has no exact cause, it is called a specific low back pain. It may suddenly occur after a strenuous activity that involves lifting due to an abrupt movement or gradually, because of overuse as a result of repetitive movements. It can also be due to improper posture overexertion, and also due to aging. A specific low back pain rarely radiates to the legs. Pain in the lower back may also originate from a damaged disc in the spine. A disc consists of a strong fibrous ring and a soft nucleus and functions as a shock absorber between two vertebral bodies of the spine. When a disc becomes damaged, it may bulge or rupture. When soft tissue from the nucleus prolapses through the rupture, it is called a disc herniation. Herniated discs usually affect the lumbar spine, causing low back pain and radiating pain in one or two legs. When the herniated disc compresses the sciatic nerve, the symptom experienced is called sciatica. If the bulging disc is not compromising a nerve, backache may be mild. Sciatica is the term used to describe the symptoms associated with radiculopathy of the sciatic nerve. Radiculopathy as a condition wherein a nerve root that links to a nerve, in this case the sciatic nerve, is irritated, pressured or pinched. The symptoms of sciatica include pain, tingling, and numbness or weakness that radiates along the lower back. To be confirmed radiologically. We still talk about sciatica due to the fact that pain radiates in the specific area of the sciatic nerve. For more information about back pain, it's best to consult your practitioner, Dr. Makkar. Pathophysiology of Sciatica. Sciatica is generally caused by the compression of lumbar nerves L3, L4, or L5, or sacral nerves S1, S2, or S3, or by compression of the sciatic nerve itself. When sciatica is caused by compression of a dorsal nerve root, radiates, it is considered a lumbar radiculopathy or radiculitis when accompanied with an inflammatory response. This can occur as a result of a spinal disc bulge, or spinal disc herniation, or from roughening, enlarging, or misalignment of the vertebrae, or as a result of degenerated discs that can reduce the diameter of the lateral foramen, natural hole. The intervertebral discs consist of an annulus fibrosus, which forms a ring surrounding the inner nucleus pulposus. When there is a tear in the annulus fibrosus, the nucleus pulposus may extrude through the tear and press against spinal nerves within the spinal cord, cauda equina, or exiting nerve roots, causing inflammation, numbness, or excruciating pain. Inflammation in the spinal canal can also spread to adjacent facet joints and cause lower back pain or referred pain in the posterior thighs. Pseudosciatic pain can also be caused by compression of peripheral sections of the nerve, usually from soft tissue tension in the piriformis or related muscles. The spinal discs are composed of a tough spongiform ring of cartilage with a more malleable center. The discs separate the vertebrae, thereby allowing room for the nerve roots to properly exit through the spaces between the vertebrae. The discs cushion the spine from compressive forces, but are weak to pressure applied during rotational movements. That is why a person who bends to one side at a bad angle to pick something up may more likely herniate a spinal disc than a person jumping from a ladder and landing on their feet. Herniation of a disc occurs when the liquid center of the disc bulges outwards, tearing the external ring of fibers, extrudes into the spinal canal, and compresses a nerve root against the lamina or pedicle of a vertebra, thus causing sciatica. This extruded liquid from the nucleus pulposus may cause inflammation and swelling of surrounding tissue, which may cause further compression of the nerve root in the confined space in the spinal canal. Causes of sciatica. Herniated lumbar discs is the most common cause of sciatica in the lumbar spine. Degenerative disc disease. Aging is known to cause disc weakness, further causing disc herniation. Some genetic predisposition may also make you prone to disc problems. Diabetes affects the way your body uses blood sugar, making you more likely to develop nerve damage. Lumbar spinal stenosis is narrowing of one or more neural passageways in the lower spine due to disc degeneration and or facet arthritis. Isthmic spondylolisthesis results from a stress fracture at the fifth lumbar vertebra. The fracture combined with disc space collapse may allow the vertebra to slip forward on the first sacral segment, causing the L5 nerve root, look in the picture above, to become pinched as it leaves the spine. Piriformis syndrome is a controversial condition that, depending on the analysis, varies from a very rare cause to contributing to up to 8% of low back or buttock pain. In 15% of the population, the sciatic nerve runs through or under the piriformis muscle rather than beneath it. Running directly above the sciatic nerve, the piriformis muscle starts at your lower spine and connects to each thigh bone. Piriformis syndrome occurs when the muscle becomes tight or goes into spasms, putting pressure on the sciatic nerve. Active runners and walkers, prolonged sitting, car accidents, and falls may contribute to this condition. When the muscle shortens or spasms due to trauma or overuse, it's posited that this causes compression of the sciatic nerve. It has colloquially been referred to as wallet sciatica, since a wallet carried in a rear hip pocket compresses the buttock muscles and sciatic nerve when the bearer sits down. Piriformis syndrome causes sciatica when the nerve root is normal. Trauma. A car accident, fall, or blow to the spine can injure the lumbar or sacral nerve roots. Also, your occupation that requires you to twist your back, carry heavy loads, or drive a motor vehicle for long periods makes you more prone to develop sciatica. Spinal tumors and infections are rare disorders that may compress the sciatic nerve. Sciatic nerve tumor or injury. Although uncommon, the sciatic nerve itself may be affected by a tumor or injury, leading to sciatic pain. Spinal disc herniation. Pressing on one of the lumbar or sacral nerve roots is the primary cause of sciatica, being present in about 90% of cases. Sciatica caused by pressure from a disc herniation and swelling of surrounding tissue can spontaneously subside if the tear in the disc heals and the pulposus extrusion and inflammation cease. Spinal stenosis. Other compressive spinal causes include lumbar spinal stenosis, a condition in which the spinal canal narrows and compresses the spinal cord, cauda equina, or sciatic nerve roots. This narrowing can be caused by bone spurs, spondylolisthesis inflammation, or herniated disc, which decreases available space for the spinal cord, thus pinching and irritating nerves from the spinal cord that travel to the sciatic nerves. Pregnancy. Sciatica may also occur during pregnancy as a result of the weight of the fetus pressing on the sciatic nerve, during sitting or during leg spasms. While most cases do not directly harm the fetus or the mother, indirect harm may come from the numbing effect on the legs, which can cause loss of balance and falling. There is no standard treatment for pregnancy-induced sciatica. Other. Sciatica can also be caused by tumors impinging on the spinal cord or the nerve roots. Severe back pain extending to the hips and feet. Loss of bladder or bowel control, or muscle weakness, may result from spinal tumors or cauda equina syndrome. In some cases, no cause may be found. A number of problems can affect the bones, joints, and muscles, all of which could possibly result in sciatic pain. Why do persons suffer from sciatica? The answer is a combination of two factors. The tissues, such as the bones, the joints, the ligaments, and the discs, and your brain. Let's look at what happens to the tissues during the normal healthy aging process. First, the discs begin to dry up. The disc is like a jelly and disc-filled shock absorber between the bones of the spine. As we age, the liquid from the jelly seeps into the outer fibers of the disc. The fibers start to weaken and bulge, and the jelly starts to disappear. This is why we normally begin to shrink in height in our late 30s and lose about 2 inches by the time we're 70 finally, because there is less shock absorption. That bone grows broader to absorb more pressure, resulting in vertebral bone spurs. The name for this process is degenerative disc disease, which simply means normal aging of the discs, and often does not cause any pain. Another thing that starts to happen because of the loss of this kite, the joints in the back of the spine called facet joints start feeling more pressure, and so they develop bone spurs as well. This is called facet joint arthropathy or facet joint hypertrophy. Again, these are normal features of aging and often do not cause pain. So how can all these things happen to the spine without causing pain? In the vast majority of cases, the reason is because, while these things are slowly happening to the tissues, the brain is able to adapt things like good sleep, regular movement, and a positive attitude. Helps the brain adapt to these changes. Imagine a 16-year-old kid who's never had back pain or joint pain ever before. Then consider a normal 50-year-old who already has some of these age-related changes in their spine, but also doesn't have any significant pain. Now imagine that one day the 16-year-old kid wakes up in the 50-year-old's body. Suddenly he would hurt all over the place. This is because his brain didn't have those 30-odd years to adapt to the slow and steady changes that happen to the body. The brain is an amazing organ that adapts to new information extremely quickly. But in order to learn and adapt well to new information, we need good sleep, regular exercise, and a positive attitude. Just like what kids need to excel in school. As long as we give our brains these key ingredients, we can adapt to the normal age process and extinguish the signals coming from our back. This is why the vast majority of people with degenerative disc disease or facet joint hypertrophy do not experience any back pain. So we looked at what normally happens to our spines as we age and how our brain adapts to this process to prevent pain. What about when we do have back pain? What's going on there? First, let's look at what can go wrong in the tissues of the spine. Remember the spinal disc that's filled with jelly. In Western society, we spend a great deal of time sitting bending forward between 0 and 90 degrees. Or lifting with our hands far out in front of us. Conversely, we don't spend nearly as much time walking, bending backwards, or looking up at the sky like our ancestors did. As a result, we end up putting too much pressure on the front of the disc, shoving jelly towards the back of the disc. Over time, the spinal disc jelly weakens those back fibers, and it doesn't take much but the last straw on the camel's back, so to speak, and some of that disc jelly pops through, resulting in a disc tear and potentially a spinal disc herniation. This is usually intensely painful. The typical scenario would be you bend over to pick something off the floor. It could even be a paper clip or a pencil, and bam, you're in the worst pain you've ever had. Unable to even move due to severe back pain. If the herniated spinal disc jelly irritates a nerve, the pain may radiate into the buttock or leg, resulting in what we call sciatica. The first thing to do in this situation is to push as much jelly back inside as you can, and to close the disc tear to let it heal. Now, if you have 2 or more of these symptoms, chances are the disc tear is still open. The pain is worse. First thing in the morning, the pain is worse, with even the slightest bending, like bending over the sink. Coughing or sneezing makes the pain a lot worse. Sitting is very painful. If this scenario closely resembles your situation, then click on this link for specific instructions on how to recover quickly. Even after recovering from an episode like this, there are some residual changes that make the disc more vulnerable to being injured again. First of all, even after the tear has healed, the jelly is still sitting close to the back edge of the disc. Secondly, the injured segment of the spine is now the weakest part of the spine. Like a coat hanger that's been bent in the middle, it's more likely to keep buckling at that weak spot. If you've recently recovered from an episode of back pain, or if you tend to get frequent repeated episodes of severe back pain, click on this link for specific instructions on how to prevent this from happening again. Finally, if there are 1 or 2 discs that have lost a significant amount of jelly, arthritis can set in early in the corresponding facet joints, which in some cases can cause back pain. If the overgrown facet joints and ligaments encroach upon the nerves, the pressure on the nerves can sometimes cause pain as well. In these cases, the pain feels better when sitting down. But then, because of excessive sitting, the hip flexor muscles get tight and pull the spine into a forward bent position, causing strain on the back muscles. In these cases, the pain is typically worse. The longer you are on your feet, the pain can be worse. when standing up from a seated position. The pain feels better when leaning over a shopping cart or a walker. The pain is quickly relieved when sitting back down. If this scenario closely resembles your situation, then click on this link for specific instructions on how to naturally manage this pain. Now, regardless of which of these situations fits your pain the best, or even if none of these three scenarios describes your situation, you can still benefit from the following advice. Avoid prolonged sitting or standing. Change positions at least every 30 minutes. Regardless of whether you're sitting or standing, your earlobes should be directly above your shoulders directly above your hips, and your eyes should be level, with an imaginary line a third of the way down from the top of your computer screen. Sometimes the kneeling chair is better for those with sensitive discs. When lifting something, bend at the knees and hips, not at the spine, and carry the object as close to your waist as possible. Stretch your hip flexors and your hamstrings. Characteristics of sciatica: one-sided pain, lightning or shooting in character. Symptoms are aggravated with change of posture regarding hip and leg, especially leaning forward, raising leg in lying posture. They often add fuel to the fire of suffering. However, in the case of long-standing history of sciatica, the pain may gradually become localized to the buttocks and back of the leg. In this situation, the patient may have a vague aching pain that does not reach all the way to the lower leg or foot, though it may have done so earlier in the course of the disease. If you suddenly start feeling pain in your lower back or hip that radiates to the back of your thigh and into your leg, you may have a protruding, herniated disc in your spinal column that is pressing on the roots of the sciatic nerve. This condition is known as sciatica. Sciatic nerve happens to be the longest nerve in our body. It starts from our spinal cord in the lower back and passes down through the hip into the back area of the lower leg. When we say sciatica, we refer to the pain in this sciatic nerve. As this nerve passes down through the pelvis, hip, and to the backside of the lower leg, the sciatica pain, whenever it occurs, is felt in the areas through which it passes. This nerve controls many muscles of the lower leg, and also controls the sensation of thigh, leg, and feet. Pain that travels from the lower back, or from the hip, through the back part of the thigh, to the lower part of the leg, or to the foot is usually very indicative of sciatica. Sciatica pain can range from a simple dull ache to severe electric-like shocks. The pain can at times be so severe that the patient may hardly be able to move out of bed. Usually patients complain of pain while walking or standing, but at times reverse of this happens. The pain is worse while lying down in a normal sleeping or lying posture, and patient has no other option other than to stand or walk or lie in certain uncomfortable posture. Patients with sciatica may suffer from additional symptoms such as numbness and weakness along the course of nerve, tingling, and pins and needles feeling, mostly in the foot or toes, and loss of bladder and bowel control. This an emergency medical condition. Symptoms of sciatica. Usually sciatica affects one side of the body. Radiating pain from lower back, through the back of the thigh, and down through the leg, to the foot or toes. Pain may be constant or intermittent. Dull, sharp, shooting, burning, or tingling sensation. Weakness, numbness, or difficulty moving the leg or foot. Everyday activity like walking, sitting, and standing may be painful and difficult. Coughing and sneezing can increase the pain. Losing control of bowel or bladder. This is a sign of cauda equina syndrome, which is an emergency situation and requires immediate medical attention. One of the major distinctions in our office is that we don't treat symptoms. We do not treat conditions. We create a treatment plan for you to address the underlying problem in your disc that is causing your pain and other symptoms. Now let's talk about the anatomy of the spinal disc. The healthy spinal disc is 86% water and needs water, oxygen, and nutrients to continue to survive. A unique feature of the spinal disc is that it is avascular, without blood, which is a fancy word. That means it does not have a direct blood supply. The only way the disc gets the water, oxygen and nutrients, the circulation, that it needs to survive, is by a very specific mechanism called the pump mechanism of disc nutrition. This mechanism works as we move, and works like a pump. If you injure the disc, the pump mechanism does not work properly, and over time will cause bulging discs, herniated discs, and degenerative disc disease, and, possibly, spinal stenosis. So the main problem causing your pain and symptoms is the failure of the pump mechanism. Now let's say we have a generic water pump providing water to a plant. If one day that pump fails, it will cause a decrease in circulation to that plant. Well, what happens to any type of tissue, whether it be plant, animal, or human tissue, if it loses circulation? Exactly. It will cause the tissue to become weak and eventually die. This is exactly what is happening in your spinal discs. The pump mechanisms are no longer working, and the disc needs circulation to be able to heal and repair. The treatment that we provide in our office will fix your pump mechanism that is not working in your injured spinal discs. So you have a decision to make. You can either continue to treat the symptoms of your serious spinal discs, which has not worked up to this point, or you can finally do something to fix the underlying cause of your disc problems. Homeopathic approach or treatment to sciatica. Homeopathy, as a natural system of medicine, offers distinct advantages to the people who suffer from sciatica. The biggest advantage that homeopathy offers is that it is able to treat the pain very effectively, and is able to rectify the compression or irritation on the sciatic nerve. Another great benefit of using homeopathy is that, along with the treatment of sciatica, homeopathy also aims at strengthening the patient's constitution in order to prevent further recurrences. Wear and tear phenomena are common for everyone. If you happen to use the bones in one position only all the time, or most of the time, then, naturally, that point will suffer more friction loss than other places. If friction loss occurs evenly, people will lose some height only with age. But, if it has not occurred evenly, then more friction loss occurring in one place can damage disc to cause disc degeneration, or disc bulge, or disc prolapse, which can induce sciatica. So, caring position is equally important against medicines to rule out exciting cause or maintaining cause. The goal of treatment should not be aimed only at relief, but also to prevent recurrence. Rebounding, recurring attack can be given knockouts when the reviver counsels the sufferer about correct posture in addition to drugs. In addition, no more attacks can be brought easily when a homeopath selects and prescribes the right drug constitutionally with detailed analyses of cause, nature of pain, aggravating factors, characteristic symptoms of disease, and characteristic symptoms of the sufferer. Homeopathy can provide miraculous relief from this nervous pain without any side effects by controlling the inflammation and infection of the nerves. Also, homeopathy can treat paralysis or weakness of the leg by rejuvenating the sciatic nerve. It favors enhancement of neuron regeneration or ruling out other causes to revive impinged nerve. In case of fractured bones, which compress the sciatic nerve, surgery may be absolutely needed to relieve the suffering by releasing the compression mechanically. Homeopathy is the only form of treatment that has shown an overwhelming positive response in treating sciatica. Constitutionally prescribed homeopathic remedies can effectively and permanently reduce pain and other symptoms of sciatica. Homeopathic medicines treat by strengthening our vital force, which is an intelligent energy principle in our body that balances many functions and provides protection from illness. Homeopathic treatment being based on the hypothesis of like cures like, and a deep emphasis on the principles of holistic medicine. Treat the whole person. Its remedies work by stimulating the body's own healing power by introducing tiny doses of natural substances that stimulates a person's immune system and defense system to correct itself naturally. Due to the individualized constitutional approach of homeopathy, a remedy which matches all of your symptoms will stimulate your vital force to restore balance and health. Homeopathic remedies are gentle and easy to take and are regulated by the FDA and formulated according to the Homeopathic Pharmacopoeia of the United States. Hence, every individual suffering from sciatica must consider homeopathy to provide relief and lifetime cure. Homeopathic treatment can change a person's life from one of distress to one of health. Dr. Makkar homeopathic treatment can contribute to an effective and safe cure in preliminary stage of spondylosis. In chronic cases of spondylosis, homeopathy can reduce overcrowding of the spine, compression of the nerves, and also conclude the progressive degenerative changes. In very advanced cases of structural damage, like a badly deformed spine, sciatica untreated leads to stiffness, pain, tiredness in spine, spondylitis, spondylosis, increased pressure on spinal cord. Other serious complications. 1. Loss of control in passage of stool urine. 2. Loss of balance while walking. 3. Pain numbness of extremities. 4. Permanent disability. Homeopathic remedies, along with a correct posture, can facilitate in living better without any complaints or pain. We can aim for near normal in all other cases. The outcome of homeopathy in managing sciatica will be remarkable compared to other system of medicines or surgical interventions. Homeopathy can provide good relief to the patients and control the progress of sciatica. We strive to give the patients of sciatica a better quality of life, free from the pain of arthritis, one that can live to the fullest.